Welcome, friends, to another episode of CNS Viewpoint. Today, we will be discussing about the news, a very important news which was in the newspapers that World Health Organization, the WHO, has verified that fake, falsified, or counterfeit versions of COVID vaccine were found in India and Uganda. The vaccine which was found to be fake, falsified, or counterfeit in India and Uganda was found outside the official vaccination program. And this vaccine was Covishield, which is actually AstraZeneca Oxford vaccine. The research was done by AstraZeneca Oxford, and Serum Institute of India is one of its manufacturers, and they make it by the name of Covishield. So Serum Institute of India has also verified or said that these vaccines which are said to be falsified, fake, or counterfeit by WHO, it's true that these are falsified, fake, or counterfeit. So, when I was reading this news, I think probably you all may agree that during the pandemic we have seen the a spectrum of faces of humankind. On one side, we have seen endless examples of solidarity, where people have come together in the hour of crisis to help each other. People have really risen, as never before in what little I saw from where I am during the pandemic, to help each other out in this hour of need and crisis. But at the same time, there are some people who have been a very sad black blot on the face of humanity. They were all busy since the beginning of the pandemic. They have been very busy and thankfully got exposed in trying to mint as much profit as possible. They were trying to profit from illness during the severest of crisis, and or from in way of black marketing, hoarding, and a range of other ways, promoting fake or spurious products. And now we also get to hear the news of fake, falsified, or counterfeit COVID vaccine, which is very, very sad. The only solace is that this fake, falsified, or counterfeit vaccine was not part of the official program. So thank God it was not. But this is not something to be tolerated, because in every country probably there are laws already in place to check, to put a check on counterfeit, fake products, be it any product. There are laws already in place. So there are government officials, machinery, laws, policies already in place. So government cannot shun its responsibility to for failing to curb or check or decimate or end this fake vaccines, or wherever these were found outside the official program. So there is already system in place. Governments need to ensure that they enforce all those laws and policies and mechanisms, so that there is no fake, spurious, suboptimal, or less effective vaccine which reaches our people. People have put a lot of hope in COVID vaccines, and governments too. And that is why governments are of the world, of probably every government in the world, is trying to vaccinate as many people as possible in their countries. We can definitely debate on which country is doing better and which is not doing better, and what could they have been done in a much better and equitable manner. Of course, there are big problems with the inequitable rollout of the vaccine, which is the major concern for me as well. But having said that, I think we all have to agree that we all want an end to the COVID pandemic. One of the hopes we for with regards to COVID vaccination is that if we are able to vaccinate a significant part of our population, then probably the it is possible that a community immunity could be achieved, and which will probably lead towards end of this pandemic. But this is only possible when a significant number of the population is fully vaccinated. But given the in a very specific period of time, so now in India, for example, the vaccination program began on 16th of January 2021, and this is almost the third week of August, or fourth week of August rather, 2021, and we have only been able to fully vaccinate about 10% of the population. The evidence as for now is that if you look at rich nations, you will be surprised to see that they have been able to vaccinate significant number of their population, 50%, 60%, or even more. So on one hand, we have the rich nations which have fully vaccinated a large number of their population, and they are sitting on a big pile of vaccines. Some of them are even contemplating about third dose of a vaccine or a booster dose of a vaccine, when WHO says as of now there is not enough evidence. They are still looking at the evidence, but on another hand, there is acute shortage of vaccines in low income countries and middle income countries. So this is not okay, because the only hope, either we end the pandemic together worldwide, or we will not be able to end the pandemic in just rich nations alone. So in such an atmosphere where every government is trying to get as many COVID vaccines as possible for its people, we have some black faces of humankind who are trying to sell and make some more bucks out of fake, falsified and counterfeit vaccines in Uganda and India. So let us hope that governments are not only able to eliminate fake, counterfeit products, all products, but of course with urgency towards COVID, false, counterfeit or fake COVID vaccines, as well as they have to ensure that the number of people who are fully vaccinated is really significantly high, so that the dream to end the pandemic becomes true as soon as possible. So I think I would like to add one more thing, that recently, I think about 2 weeks ago, the World Health Organization experts briefed in an online briefing that we actually don't know what percentage of the world's population needs to be vaccinated to end the pandemic. But what we know is that it is going to be very high, given the other viruses and whatever they have calculated for other viruses and disease-causing germs. So one of them is about, one of the experts shared us about measles, that probably around 95%, if I remember correctly, of the world's population needs to be vaccinated so that to eradicate or eliminate measles. But for COVID, it is going to be, we still don't have that exact numbers scientifically, but we do know it is going to be relatively very high, and that is why as of now, countries are and governments all around the world are trying to vaccinate 70% or something somewhere like that of the population, and then as per that, as scientific evidence emerges and as the WHO guidance will come up, on how many more we need to vaccinate to effectively eliminate coronavirus from the planet. Let's hope it happens. Let's hope. I still have my hopes high that the pandemic will be behind us, and not only the pandemic will be behind us. More importantly, we should learn the lesson of what makes us vulnerable to these pandemics, and one of them is the inequity, and which is so deeply rooted in our societies. So I think with these words, let us hope that fake, counterfeit, falsified versions of the COVID vaccine will be history. Governments will firm up enforcement of all the laws and regulations, mechanisms which they have in place to eliminate fake medicines, fake products, and of course scale up implementation of all possible spectrum of approaches towards responding to the COVID. So meet you tomorrow 5 p.m. in on this thoughts about some other issues in next episode of CNS Viewpoint. Bye till then.